Thank you all. It's my honor to be with you today. Today, I will present the study entitled Mortality, Morbidity, and Access to Care Among MSF Staff and Families in Gaza Occupied Palestinian Territories. The conflict began on the 7th of October 2023 until the ceasefire was taken place from 19th of March 2025, and the war resumed on the March 18. The survey covered only the period up to the ceasefire. As of May 2025, the Gaza Watch reported more than 54,000 fatalities and more than 123,000 injuries. As you know, MSF responses focuses on supporting hospital and BSC and providing water and sanitation. The main objective of the study to estimate the crude mortality rate and measure cause of death among MSF OCP national staff and family member living in Gaza, occupied Palestinian territories since the beginning of the current conflict. Our secondary objective is to obtain an indication of major injuries, recent illnesses, and major chronic disease, access to care, and access to obstetric services. We did a cross-sectional retrospective mortality survey with all MSF staff who have been under the MSF contract at some point since the beginning of the conflict. As a household member, we consider everyone living in the household 1 week before the war and only included birth during the recall period. The data were collected were done from the 29th of January until the 26th of March, mostly during the ceasefire. The total staff included in the survey was 436 out of 443, with a response rate like 98%. The total number of household member is more than 2,500 people with a median household size 6. We asked the household member how many times they changed their location. The median was 5 times during the current conflict. During the survey also, 41% reported to live in a tent and 23 in a rented house. 59% of MSF households, they reported complete destruction of their houses, and 39% of MSF households, they reported partially destruction. On the right side, you see the survey population in color by age and sex, with the female in red color and green for the male. The black outline indicate Gaza population distribution from the census in 2017. You can see that both distribution are pretty similar, with MSF household more old people and less young people. The overall mortality rate for MSF household was 0.41. The mortality rate was higher for violence with 0.33 compared to the non-violence death. For under 5, mortality rate was 0.7, which was also higher for the violent compared with the non-violent. The total number of deaths among MSF household were 54. Violence was the most dominant cause of death, with 74% who died overwhelmingly due to the blast. The remaining 26 were non-violent deaths, such as those from chronic disease and neonatal death. For the death by the age and the sex, on the left side, you see the distribution by age and sex of the non-violent death, and on the right side, for the violent death. The children under 10 years old show the extreme burden, accounting for 40% of violent death in MSF household, while the 36% were between 20 and 50 years old without any difference in gender. To look at the death over the time, we divided the time from the start of the conflict until the ceasefire by 3 equal time period, 156 days. The mortality rate for the violent death was highest during the period 1 and were the lower in period 2 and 3. In contrast, for the nonviolent death, increased over the time. For matching the survey deaths with MOH data, since the beginning of the conflict, Gaza Ministry of Health periodically released the list of violent deaths. MOH list and survey deaths compared by ID, name, and age and sex. From the 40 violent deaths in this survey, for the 33, there was national ID number reported by the household members. We found 29 of those deaths in a MOH list, which equal 88%. And there is no non-violent deaths were identified on the list released by MOH. For the injuries, among the included households, 7% reported having been injured at least one time during the recall period. 91% of all injuries were caused by blast. The most common type of injury was burn and soft tissue wound with the 58%. 73 acceded care, mostly hospital and field hospital. The main reason for not seeking care, immediate death and distance and security. We asked the participant about the illnesses in the last month. In the last month before the interview, 44% of MSF household reported acute illnesses. Among all diseases, the most prevalent illnesses was upper respiratory tract infection with 27%. 95 of MSF household have had access to care for the acute illnesses. For the chronic disease, the prevalence of chronic disease among MSF household was 15%. 70% reported one chronic disease and 30% report multiple chronic diseases. The most prevalent disease was cardiovascular disease with 46%, followed by diabetes mellitus. 68% of MSF household member with a chronic disease reported treatment interruption. The median number of interruption was 2, and the longest interruption was 60 days. For the pregnancy, among women between 15 to 49 years old included in the survey, 13% reported at least one pregnancy reported since the beginning of the conflict. 100% delivered in a health structure, hospital, or BHC. There was 6 spontaneous abortion were reported. The 3 neonatal deaths resulted in the overall neonatal mortality rate of 42.3 per 1,000 live births. For the conclusion, as we mentioned, 74 deaths due to the violence, equivalent 1.6 of MSF household member. 40% deaths caused by violence were among children under 10. We notice increasing trend of non-violent deaths related to deaths over the time. We compared our result with the MOH pre-war level estimates. The mortality rate was 5 times higher than the pre-war level. The under 5 mortality rate was 10 times higher than the pre-war mortality rate, and the neonatal mortality rate was 6 times higher than the pre-war mortality rate. We noticed there is a concurrence between survey and Gaza MOH list for violent death, and there is no evidence of other non-violent deaths included. 20% of MSF household had member injured from blast or gunshot. We notice also good access to care for MSF household. 2 to 3 with chronic disease experience 1 or more treatment interruption. Actually, we have the limitation that this study not representative of the general population. And the last thing, this survey does not reflect the recent escalation of the violence since the end of the ceasefire. I would like to acknowledge our participant, MSF staff in Gaza. Those did an incredible job during these difficult circumstances. Our data collectors, all co-investigators, our team in Gaza and Jerusalem and Paris and Epicenter. Also, as a research team, as MSF, and as a civilians, we call for urgent ceasefire. Thank you for your attention and listening.